Live. Welcome everyone to our live on Natural Childbirth 101 tonight. I'm looking forward to everyone joining me. I'm Kaleem Joy. I'm a licensed midwife. I'm a certified pediatric massage therapist and a certified professional midwife. And I work a lot with little babies. And these little babies come to me usually because of nursing problems or irritability, sleep problems. They have feeding problems as well as breastfeeding or even bottle feeding that they're struggling. And so I get to see babies. In addition to being a midwife, my now moving into that next career is I'm also a massage therapist. So I'm a certified pediatric massage therapist. So I wanted to talk about something that is so prevalent, and especially when I have children that come to see me. Often one of the things that has been going on for them is a tongue tie. So tonight's topic is about tongue ties. And although I'm going to touch a little bit on the breastfeeding side, thank you, I want to move in from the breastfeeding to beyond. What does that really mean? So I want to start out with understanding that, say, 10, 12 years ago, I remember seeing one of our moms after she had given birth, and we had, she'd had a little bit of nursing challenge, a little bit of milk supply, but was working along with it. And she said to me, she says, "I think my baby's tongue is tied." And I thought, tongue-tied? The baby can't be tongue-tied, really? How did I miss that? Okay. And, because we all check their suck. But I was not to the understanding of learning to check for a tongue tie, because frankly, I thought they were very, very rare, and that was really super uncommon, and that wouldn't be something more than likely that most of our families would deal with. So I came from a place of not understanding them. And what we've learned over the past, say, 3 to 4, maybe 5 years at best, is the prevalence of tongue ties. We understand that some of that may be genetically. It may be because of the mutated gene, the MTHFR. It may be environmental factors. It may be that we are more aware of them and we know what to look for and what the signs and symptoms are, that maybe they've been there all the time. Yes, absolutely, with this MTHFR, because of the folic acid folate issues, which causes midline issues, right? And some of those are going to be a tongue or a lip tie, which sometimes goes along with an umbilical hernia, which sometimes goes along with undescended testes or things that are in midline. So I wanted to bring up more than just the breastfeeding, because we know that the breastfeeding tends to be one of the first symptoms, aside from having someone, a midwife, a pediatrician, whoever it is, to check for a tongue tie. And as midwives, we're getting better about checking for them, because we're learning about what we're feeling for, what it is that we should be seeing, feeling in the baby's mouth, and not just that the baby is latching and doing fine, or the baby's struggling to get on breast because they can't feel the breast because the tongue can't find it well. Remind me, hey, rooted in grace, tell me where you are. Tell me what area you're in, what time zone that you're in, so that I can maybe find a way. And that's one thing I would love to hear more from people. Is there a better time than at 7 o'clock Pacific Standard Time to meet all of you? All right, back to tongue ties. So with the tongue, we know that a tongue tie means that the little frenulum underneath the tongue is short. It's tethered, and it can be tethered back behind the mucosal or the tissue that you see. It can be tethered in front of that, in front more, and all the way out to the tip. And when it is all the way out to the tip, it can be very obvious because the baby has a little heart shape in the tongue. In other words, it pulls, right? And when it is attached even further back, it pulls it down, which means that the tongue may arch in the back, which means the nipple rubs, which means that breastfeeding is challenged. There's damage to the nipples, and even with milk supply. All right, so when you look at breastfeeding being one of the first segments of challenges in having a baby that's tongue-tied or lip-tied I wanted to go over maybe what is the bigger picture with this, because sometimes I will have families that may have been approached that there was a tongue or a lip tie early on in their relationship after the birth was over. Maybe it was right at the birth, maybe it was a week later, maybe 2 weeks, maybe 6 weeks. They were told that the baby has a tongue tie and that they should go and have it revised. And like all good parents, we want to protect our children from having any kind of trauma or harm. And going to have a revision can feel really invasive to the baby and really feel in your heart like, I don't want to have my baby subjected to something that could hurt. And that is one of the things that I want to expand on with this, because I sometimes see these babies and they may not have revisions until they are much older. One, maybe it wasn't picked up on because the posteriors sometimes aren't for a while, and sometimes it can be because of a delay in wanting to get it fixed until enough problems have occurred that they feel that that may be the only option to solve it. All right, so let's go from the feeding side of this, because we sometimes get caught on the feeding issue and what is it that can solve a feeding issue either at breast, and believe it or not, even a tongue-tied baby can have trouble on a bottle because they can't keep the bottle suction, which means they drool a lot of milk, they get a lot of gas from clicking, and there's a whole myriad of other things even with a bottle-fed baby. So it's not just, oh, well, I just won't nurse the baby then, because that doesn't solve the problem. The problem is when the tongue is tethered down, when it's tied, all right, it causes the arching or a bowl in the tongue. And what happens to that is that there are innumerous muscles that cause the tongue to collect the milk and bolus it down the throat. So when the tongue is tethered, that means that swallowing does not go as well as it should, which means that if a mom has a good milk supply, which you hope with a tongue-tied baby that she can, the swallowing may be difficult to handle the amount of milk that's coming at the baby. Maybe it's that a mom does have a lot of milk. Maybe she does have a strong reflex to let milk down. But maybe the majority of the reason is that the baby is struggling with handling the milk going back and down its throat. So you have that issue, a baby that feels like they're choking or that they're drowning when they're nursing. And so it's not just the milk supply. The other thing is that milk supply tends to wane down in babies that are tongue-tied often. By the time the baby's about 3 or 4 months, they can't keep the supply up because they have to nurse longer, more frequent, because it takes a lot more work to get their milk. So they can be really cluster feeding babies, and moms can say they're just always feeding, they're never satisfied. That's another issue. So we look at it from, okay, well, fine, then I'll give my baby a bottle or I'll give my baby formula. But you haven't solved the problem. The issue is still there. The baby is struggling with managing to get the milk down in its stomach. And a baby's prime thing to do when they're young, when they're really in the early weeks, is to eat, right? That's their whole job, is to suckle and eat. Neurologically, nutritionally, chemically, It reduces their stress hormones. So when eating becomes a stressed time every hour and a half to 2 hours, this creates even more difficulty for the baby themselves. So what are some of the other things beyond feeding? When you look at the tongue on myofascial, and myofascial, if any of you have had that type of therapy or anything, myofascial is like the saran wrap that kind of holds us together. It's very fine tissue. So that myofascial goes from the tongue, down the neck, down the back, through the bottom, down the legs, over the feet, and to the toes. So if the tongue is tethered, then that myofascial is shortened. That means that over time, when the baby is trying to feed, they will cock their heads back in order to give as much extension to the tongue as they can. And the more they do this over the course of like 2 weeks, 4 weeks, 6 weeks, 8 weeks, the more they do this, the more they get the back that's already got some shorter fibers because of the tongue and the way it works. The back begins to become where you have a baby who likes to arch. And I love when parents say, oh, they love to stand up all the time. I just take their little hands at 4 weeks and they stand right up. And they're so strong. Their neck is so strong. They're not supposed to be that way. They're not supposed to be able to stand up at 4 to 6 or even 8 weeks. They're not supposed to be able to hold their heads when they're on their tummies at birth and hold it strong, 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 strong. Something's going on. They shouldn't be that strong. But as they grow, things get stronger, and then what occurs is they lay on their backs and they wiggle and they turn and they wiggle and they turn and they're moving. I call it they dance a lot. And what they do is they push up with their feet. They push their hips up and they're always moving. This is a signal to me that a baby has tightness, tension in their body. Is it from a tongue tie? It may possibly be from a tongue tie. So that's one of the things to check for. So when this type is going on, the other thing in the front is that the diaphragm and the stomach are now getting congested. This causes reflux. And I see so many babies with reflux, and these sweet little babies are having a hard time because their body has now become more and more tense because feedings are stressful. The tethering of the tongue goes all the way down their sweet bodies. And now the stress and everything is creating more acid, because to have a baby who is a newborn or even a month or 2 old who has too much stomach acid, somehow that doesn't make sense to me. Now, I get that their gut flora needs to be handled as well, all right? So you have a baby who now is having a stressful feeding sessions every time they want to eat. And their body is now getting into patterns that are making those muscles stronger, which means it pulls on their necks. I would have a neck ache, a headache, if I had that pulling on me. So now let's go a little bit further. When they are doing tummy time, which these babies really shouldn't be doing tummy time until they get relaxed, then they should, so that they can use their arms and their head and their neck instead of their back to hold them up and roll over like little peely bugs, right? And so they get stronger and stronger. And what does this do? Well, it pulls the jaw. It causes their gum lines to continue the arch inside, to get higher, which pushes on their nasal cavity. And when it pushes on their nasal cavity, they don't breathe as well, which means they mouth breathe a little more. And that means that their nose doesn't filter the things that it should, which means they're more at risk for allergies and colds, and also ear infections, because the tongue is not clearing the eustachian tubes. In fact, it backs up milk sometimes. Okay, so you starting to get where I'm going with this? All right, well, let's keep going, all right? Hang in there with me. So as they grow without having this tongue done and having this behavior that their body has had to do, they're smart. They're learning to compensate. This is how they compensate for something that they need so desperately to be able to do, which is eat. And their body has to compensate in order to be able to eat and to swallow, because what we learn is when they do this, they are able to swallow, you see? And it's difficult for them in different positions to swallow like you and I do. So they compensate by throwing their head back or pushing their chin back in order to compensate for swallowing easier. And those muscles have to be able to work. They're so smart. They want to eat. So they compensate. So then as they go along, their gum lines actually begin to pull in and arch up, which means in the future there is more tightness to their teeth. That means more risk of cavities because there's food and things that get stuck in them. It means more possibilities of braces, more possibilities of having palate expanders in children that are older in order to correct some of the issues, and they have to wait for the bones to kind of grow. So there's sleep apnea, there's snoring, there's babies who have to sleep like this in order to keep their windpipes open because the tongue wants to drop back in the mouth and cause an occlusion, which doesn't feel good to them, right? All right, so there's a lot of these things that go on in a baby just from a tongue tie, not to mention speech, okay? So let's go back and rewind the clock for these babies and for other babies and say, let's look for a tongue and a lip tie when they're born and in the early weeks of nursing. Because some of what I see is that some babies, because their mamas are good milk makers, they go on and they kind of chew the breast, but the breast gulps and they gulp that milk pretty good, all right? But what happens is that they gulp, 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 and then they come off and they keep crying because it's too hard to swallow. Also, they tend to struggle with the ability to handle solids. When they start on solids, those solids can be really gaggy. And some of you may have known a baby who was really a gaggy baby, both on milk, on phlegm, on solids. The question is, did they have a tongue tie that tethered their tongue? All right, so all this sequelae, if the baby does have a tongue tie, to get the tongue tie revised, that we have so many wonderful practitioners now who know and understand this issue. We have a lot of practitioners who don't. Your pediatricians, your ENTs, ears, nose, and throat doctors, they don't necessarily understand tongue ties from the full body point of view, from the lifetime point of view, from the feeding point of view, unless it's really out of normal. So unless they've been really going to conferences, learning about these things, don't expect them to understand. You want a certified lactation specialist or a midwife or a body worker like myself or someone who deals with tongue ties. We have, like in our Northern California, we have a tongue tie clinic. In many places throughout the United States, there are tongue tie clinics that you can go and have a baby evaluated and revised. Now let's talk about the revision and about hurting a baby. No one wants to do that. And I have families who say, but I didn't circumcise my baby for that reason. Why do I want to do this? Because of the all over big picture that goes on. Circumcision is cosmetic. A tongue tie is a functional issue that causes its own set of problems, okay? So the revision is quick and it's simple. There are 2 ways to do it. One is by laser, where it kind of goes through slowly through that tissue, and the other is through clipping. Most of the people are starting with the dentists, occasionally an ENT if they're on board with this. Most of them use laser now. Not very many people do the clipping. There's advantages, disadvantages both ways. When I have somebody who's going, I recommend that they use some homeopathics in preparation, right after, and the first couple of days to help the baby on its emotional as well as physical. And the other thing that goes into this is knowing that there is post-revision care that has to be done by the parents. And that post-revision care can be a little bit challenging because sometimes the baby is upset when you do it. And it has to be done every 4 to 6 hours during the day. Why? Because when you sever that little frenulum under there, and when you get off the call, go in the bathroom, lift your tongue, and see if you've got a membrane there that is holding your tongue. For those of you that can't stick your tongue out really very well past your lip, chances are you have a tongue tie that's there. And like I said, there's also lip ties. So when you have a revision, they swaddle the baby. Someone is in there. They're holding the baby's mouth open, lifting the tongue, and taking and getting rid of the tissue or clipping it through. And what occurs is this little tiny sort of triangle, all right, that has opened up the membrane in that area. And the goal is to make sure that when you do the stretches, which you go under the tongue and stretch up to help stretch the tongue so that the muscle will work better and faster, you go in and lift up and hold, and in and lift up and hold, and in and lift up and hold, and go across where the wound is. Now, I always say, put something wet on your finger. When I suggest the homeopathics, I have them put it in some water and use their finger to dip it in to do those stretches. And going across the wound, within about 3 days, it becomes kind of a yellow-white sort of scab that's in there. And so then it stays open. If you don't do those, it wasn't worth doing the revision because it will reseal if you're not careful. And breastfed babies, it tries to stay open. Bottle-fed babies, it closes easier. So it's really important to do those stretches, including doing some massage to the muscles in the cheek that have had to work extra hard to hold on to the breast or nipple to be able to feed. The other is doing lateral movements down the side of the tongue to get the tongue to move laterally, and stroking the tongue and getting them to suck. And there's things on YouTube that you can go look at, and the practitioners who do this usually will give you these exercises. These are wonderful, but you also can learn to do them, and you'll see that on YouTube, is to kind of lovingly play in the mouth and let them explore and smile at them and laugh and make it a game, especially if they're a little bit into closer to the 6-week time. In the newborn stage, you just have to lovingly get the work done and get them back to breast, because those babies, they just want to suckle, okay? And you need to do it for a time period. Now, the other thing, aside from the oral, is we talked about all the things that going on in the body, in the diaphragm, in the stomach, in the back, the neck, the shoulders, all the way down the buttocks and into the feet and toes. Finding someone who does craniosacral, Bowen, massage, a combination of those, including your own work of massaging up your baby and stroking up and down the baby's back of its legs, up into its buttocks, up into its back, up and over the shoulders and back, over the shoulders and back, down through the arms, under the arms and back, to help those muscles gain some length in them and some relaxation. When I have the babies, like I described to you before, that get on the table, that are kind of doing this and moving their head back and forth, and their body is dancing and their legs and their feet are pushing up, this is a baby who is very uncomfortable. And doing the massage work and getting the releasing on them, they finally relax into the table or wherever they're laying. Their body relaxes, their knees come up, which is what they're supposed to do. They shouldn't be pushing down. And their arms relax, and they begin to go, oh, finally. And what that does is it gives the length to the tongue as well. Now, I have directly seen babies who were doing this, and then they have the revision, and then I see them within a couple of days, and it's phenomenal how much their body relaxes just by handling the frenulum under the tongue. So don't underestimate the power of the tongue and what it can do. It is a powerful tool in the body, and it is connected to so many other things that are going on. All right, I'm getting ready to open this up to questions. So I'm going to start finishing my part of this and then be ready to start firing off some questions to me. Some of the symptoms of a tongue tie is obviously your nipple injury, the things that I described in the baby's body. When the baby's nursing, when they're on the breast, they like to pull up on it instead of nursing in a more comfortable position because they're trying to extend the tongue. So there's things to be able to watch for. The clicking on the breast, because they're breaking suction every time. If you put your finger in the baby's mouth and as they're sucking, hey Sasha, as they're sucking, if the tongue does not go over the lower jaw, there's a problem going on there and it needs to be looked at. There's the choking, the strong letdowns, babies that are irritable, sleeping, believe it or not, because of all of the stuff that it does onto the palate and the nose and the mouth breathing and the throat and the positioning, babies can really struggle sleeping. Guess what? It affects how they poop. I know, it sounds crazy, doesn't it? But this whole mechanism affects how those muscles in the back are able to work for pooping. And so when their muscles get relaxed, the poop comes easier, the body milks easier, and the stress levels in the baby go down. And guess what? All of that has its story for the baby, but it also has the story for the parents. And for any of you who have ever had that story going on, you know what I'm talking about. Your babies are always fussy. They're struggling to be held sometimes, to eat, weight gain, getting milk in, pumping, finger feeding, bottle feeding, using SNS, all these things. And it's so much work on you too that it takes time for you to ground back down again the same way that the baby does. When I have a baby that's gotten that far, it's going to take me 3 to 6, 7 sessions to get that baby back into a place that the baby can now take over and the parents can take over their work. All right, let's see, did I get it all for you? I think I did. Okay, I am ready to take questions, whether that's about breastfeeding, tongue ties, muscle works, things that you may see in babies, comments that you have of things that have occurred in babies that you have seen. Just start firing me off the questions. I did not understand tongue tie, as I said to you, when I had a client who said to me, I think my baby's tongue-tied. And I at first, like I said, thought, I've missed this? How did I miss this? That would have been so obvious. And so that's where I know now that it's not obvious unless you know what you're looking for. And again, don't expect your pediatrician to know what they're looking for unless they have really gone and understood this. Because I've had babies still in my practice who have gone to the ear, nose, and throat docs and they've said, oh, it's just not that bad. I'm like, it doesn't matter whether it's not that bad, the whole baby is being affected by this. And to have the tongue revised can stop the reflux, can stop the uncomfortable behavior, can make the sleep go better, and everything that's going on for those babies. And they should feel happy and calm and enjoy things in life. And you shouldn't have to be stressed, or moms and parents shouldn't have to be stressed either. Yeah, right on. So we sometimes have to address that as well for the parents, because it can be a lot. All right. Do I have questions that you would like to ask tonight? I'm not getting any off of Instagram or anything else yet. I have, when I've seen babies in my office, it has definitely been a learning curve. And in our conferences, 3-4 years ago, we'd have maybe a half a day on tongue ties. Now we have 2 full days in our conferences on these because we understand more. Oh, thank you. So much valuable information. My nephew had a tongue tie and it wreaked havoc on my sister-in-law's nipples. Yep, it does. Once he had the revision, breastfeeding became so much easier. It took a long time for her doctors to figure out what it was. Absolutely. Like I said, they're not always geared, and I've had babies that are classically tongue-tied and the whole issues are there. And part of the reason that the nipples get damaged is that, especially when it's an arched tongue, the nipple hits the arch, and so every time the baby sucks, that nipple is getting rubbed. Okay? And most tongue-tied babies also do not like the nipple back as far as it needs to be because it feels like it's going to gag them. So they'll try and keep the nipple more forward in their mouth. All right, here's some more. Help them latch. Best thing ever for us to have it fixed. Yep. And being able to breathe correctly will bring lifelong help. Absolutely. You know, it's like I've said, you can go to a lactation specialist if one does not understand how to look for a tongue tie. You can go to somebody to help you learn the functional of how to latch a baby well. But if a baby can't latch well, it doesn't matter how much you're trying. The baby's frustrated. They can't keep the nipple in their mouth. They keep injuring the nipple. They keep breaking suction. They get gas, etc. And it needs to be revised for many, many reasons. And that breathing is real important because they do become snorers, mouth breathers. They get sick. And when they can't sleep well as children, they can be very grumpy and irritable. They don't grow well. So there's a bigger picture here that we're missing. So if you have someone that you think that might be an issue for them, tell them that they need to have it checked by someone who deals with tongue ties. And many times there are many dentists, and they deal with tongue ties and the revisions of them, tongue tie clinics, lactation specialists, midwives, but you want to ask them, how much do you work with tongue ties? If they say, oh, we see them from time to time, they're not skilled in it. You want somebody that says, I deal a lot with tongue ties and I feel very good about diagnosing them, or at least evaluating that they are there to go and have them revised. So make sure that you contact someone, because it makes all the difference in how things. So a baby who's a newborn, especially like, let's say that you're in whatever setting, really, hospital, home, birth center, it's more common in a hospital setting, is that after the baby's born, and you know, we like babies to go to breast, right? And when they get ready to go to breast, there's a learning curve for everybody. The baby has to learn to suck the breast back into their mouth, hold on to a suction, and then start milking. Now, they're very instinctual. They do know how to do this, but the second time that they latch, sometimes they have to kind of figure it out, and then they get it. But a baby who keeps going to the nipple, and even if the mother or a care provider is helping and the nipple is right there, if the baby cannot feel it on its tongue, it can't figure out where it is and how to draw it in. They lick the breast, they get that tongue out, they feel it, and they draw it back into their mouth. And so if they can't feel it, and they're struggling with nursing and they can't seem to get the baby on, and the care provider's trying to get the baby on and the baby just can't get on, here's what occurs. The nipple shield comes out, because that's the quickest solution in a setting where your care provider may not have as much time to work with you, such as in a hospital. The nurse can only work with you for so long before she has to go to other patients, right? And they pull out a nipple shield. They teach you, hopefully, how to put it on. The baby then has something firm that's long that the baby can feel it in the back of its mouth, and the baby has the ability to kind of latch onto the nipple shield. All right, so baby's latched. It doesn't mean that the baby has a deep latch. It may pinch the nipple still. They don't milk the breast as well because they don't stay on. They don't maintain a suction, so they can't bring down milk. So then the mother does need to pump as well in order to bring in enough milk. If she brings in enough milk the first week, she still has to be careful after that she can. Now, the problem is get the tongue solved. Occasionally now, I'm seeing them solve it in the hospital. Yay! Okay, so that you don't have to wait until discharge, now going and finding somebody to handle that revision. So being able to get it solved as quick as possible helps the baby and it helps the birth giver to get the job done and eliminate patterns from setting in to the baby as well as the birth giver, and be able to get the team working well. All right, so the nipple shield's there. Then you have to go and start weaning off the nipple shield. And that is not always easy because the baby is not used to maintaining a suction. It's used to something being there that always is available, and they don't have to root and go on. So there's an art to using a nipple shield at the right time and place, and sometimes it's a good tool to handle time, to keep baby at breast until that issue can be solved. But it's not always a solution to a tongue tie. The tongue tie has to be revised, not the other way around, that you use a nipple shield. All right, Janine, let's see what else you had to say. Tongue ties will also eventually lead to speech issues once they're in school. Had my son's tie released at age 7. Exactly. I mean, it has to be released much earlier on. But like I said, a lot of us didn't know that they were there, right? Now we do. So look for people. All right, let's see what else she said. I've heard stories of midwives back in the day, swiping under the tongue at birth. Is this a myth? No, it's not. I was told that my brother had this done when he was born at home in 1971. So this is what we hear also. I can't tell you that I've seen the research for somebody who put the stories together, but they suggested that they would loose their tongue. That term was used, that they would loose their tongue because babies needed to nurse. Formula, bottles, things of that nature in the 1800s didn't really exist. You had to find a wet nurse or your baby didn't thrive or it died, okay? That's what would happen in some of the lower economic status because they didn't have extra milk. Or they would find a cow and they would feed the baby that way by getting the milk from the cow and giving it to the baby. But they would become anemic, so that's a challenge on that end of it. But no, they said they would swipe them across. Now, whether they did it with their fingernail or not, I don't know. An anterior one that's connected up towards the tip that's just really paper thin might be able to be taken across like that. The more posterior ones would have a difficult time because they're thicker. And I don't know if a fingernail could be sharp enough to do that. But it's always possible that they used other ways, but they told, the history is that they would use their pinky. And if you really want to go into a kind of crazy thing, midwives were called witches back in early Salem years, right? Because they used herbs, people got better, they had long fingernails, okay, which was used for that and for breaking water. So you can go and research that one. That one's quite fascinating. All right, what else have we got? More questions? More comments? All right. So keep them coming. You know, like I said, I've learned through the years. I'm really learning tremendously now to look more and more, because of the body work I do on these kids now, that I really didn't understand years ago. I saw certain things of behavior, but I didn't understand in the baby what they were trying to say. And I'm so grateful now that we have a lot of clinics and people who really understand, not only in the US, but throughout the world. Here in Sacramento, we have several dentists that do revisions. We have a couple other IBLCs that have in their offices able to do revisions. There's a tongue tie clinic that's in Castro Valley with Dr. Yazzie, and he does. But as I said, I've seen them online many places, and it's refreshing because a lot of times in the clinics, or even with some of the dentists now, they have body workers. They understand this now, that it's a whole body thing, and the babies are getting that kind of care. All right. I think I'm getting about done, if nobody has too many. Oh, Janine's got a few more comments on this. They don't do mine, and I've been told that I have a tongue tie. Yes, I've seen a lot of parents with it. Thank you for this information. I wish everyone knew this stuff. Game changer. Thank you, Janine. Yes, it is a game changer. And I think that, you know, more and more we're getting parents that are being able to speak up now, because they have had challenging nursing issues, and then the reflux, and the baby's having struggle, and the weight gain's struggling, and then only to find out that the tongue tie was an issue that could have been solved before. And I think to be able to help take the information that I've given you tonight, just remember this. Remember it. And when you see a friend, you see a family member, you see a baby that, you know, is in a class with you or something like that, and you hear parents talk about it, you know, just say to them, it would probably be a really good idea to get some body work done, and maybe look and see if the baby has a tongue tie. I've heard a lot about that. I can tell you, 1.5 years ago, I went out and I was working on a set of twins, and the parents said to me they are suggesting that I get the baby's tongue clipped because the kids will sleep better. And I went, how is that going to affect sleep? Okay, so it really is a new and upcoming awareness that we're getting the word out, and you, all of you, have an opportunity to tell whoever's on your feed and help them to tell whoever's on their feed, so that more and more and more babies get this handled who need to get it handled, and more birth givers, more moms who are nursing don't have to suffer through weeks on end of so much, not only physical trauma, but emotional trauma. And we want things to go well. We want things to be better. The younger that they are that have the revision, the less patterning that they do, and the better that everything grows and does things. As Janine said, her son was 7. That means that there's a lot more work that has to be done on dental and everything else, because of the fact that they grew that way, right? Fortunately, children when they're young can also grow more if they have that ability to expand like that. And the younger they are, the less pattern they get, the easier it is to correct some of that and prevent some of it. I've had even the recessed jaws can be partly from the tongue. And so if a baby has a real recessed jaw, it's like, don't just say, oh, they have a recessed jaw. No, they have a tongue tie, and they're going to need time to grow that jaw out, because the tongue has tethered it back during their in utero time so much that the jaw just needs time to grow. But your children are amazing. All of you are amazing to join me. And I just want to thank you again for joining me tonight. And if you're watching this after the recording, thank you. Thank you for coming. Thank you for watching this. Thank you for taking the information, learning from it, and having a chance to give it to others so that others can have more resources to know how to go forward. All right. So I guess I'm going to close down for the night. Thank you for the love hearts. Thanks for the emojis. Thanks for your comments and your questions. And I will do my closing. Thank you so much, Cadence. I appreciate it so much. So go in, hug your children, and it doesn't matter how old they are, doesn't matter how young they are. If you don't want to wake them up, hug them in your heart, but be near them, and tell them that you love them. Tell them they're amazing and that they can do anything that they set their mind to. I will see you next week, next Wednesday, with a new topic, and I hope you have a wonderful week and enjoy the sunshine and the beautiful colors that our world is giving to us for fall. All right, bye for now.